Hi everyone, I wanted to talk to you about the concept of chin augmentation. Basically, one of the issues we run into is that there are individuals who either genetically have a receding chin or with just aging due to loss of an atrophy of fatty tissue and wrinkle formation, the chin kind of thins out. And as a result, people begin to get what we call marionette lines. Some people start getting dimpling of the chin, which is called peau d'orange, due to basically a hypertrophy of our chin muscle because of a lack of support. And if the bone basically is receding, you'll see this flattening of the chin. So the causes could be as deep as bone, lack of proper soft tissue, as well as just collagen loss. The way we treat this, traditionally has always been chin implants. But one of the issues with chin implants is that as we age, we do get atrophy around the chin implant, and the chin implant can actually protrude and be noticeable. A more practical solution I find in my practice is actually using fillers with hyaluronic acid. It's a procedure that can be basically performed in a matter of 20 minutes, and we can get really dramatic improvement. The hyaluronic acid fillers behave as implants. They are gel implants and they last really up to 2 years without undergoing any surgery, without any scarring below the chin. I find it really requires evaluating the patient properly. One of the common things that gets overlooked is that when patients present for facial augmentation is that basically fillers are placed, let's say, in the laugh lines, maybe even in the cheekbones. However, when you look at someone's profile, you really need to assess their chin and whether it sits pretty much perpendicular to where the upper and lower lip meet. If the chin is really recessed, it does lead to issues with jowling, and it even leads to issues with neck heaviness. So once the chin is properly filled out, you can actually improve what we call the submental angle, which is the angle from below the chin and the neck, as well as really improve the jawline and improve the marionette lines. So it's an area that I think when it's properly contoured, along with upper cheekbones, it can really improve the aging process. So I always look at that area, and then if someone needs fillers, it's about educating the individual to help them understand how fillers can make a big difference. And again, I use a filler called Voluma, and it's injected through a cannula. This way there's hardly any bruising, and I can really contour the angle of the chin. We can also put some in the front of the chin. Within a matter of 15-20 minutes, you actually see a dramatic change in the contour of the face and proper placement of the chin. Hopefully this serves as good information for you all, and if you have any questions, feel free to reach out. Thank you.